In 2019, the General Assembly asked Virginia's Department of Corrections to team up with the UVA and VCU health systems.
The General Assembly was likely looking for increased access to care for offenders. We have a lot of off-site appointments for specialists. Being associated with a university like UVA could increase the retention of staff.
It comes after the state has seen rising costs and an increasingly older inmate population.
The reality is now that we have no parole. Our inmate population is getting older. Healthcare demands, their needs are increasing, and we just simply have to find a better way to provide for that care.
According to a report from the Virginia House Appropriations Committee, prison health spending has nearly doubled from $120 million in 2007 to $230 million in 2019.
It is frustrating, particularly when you're competing for dollars. When we've got to improve our educational program. We've got needs in our state parks.
Supporters believe the partnership between the DOC and UVA will be threefold: boost healthcare access, bring prescription drug costs down, and help with recruitment.
I absolutely think it will increase access to healthcare and access to highly qualified healthcare professionals, which is something we struggle with. People don't come out of medical school and nursing school thinking, I'm going to work in a prison.
Those positions are always going to be hard to fill, and we have to, in my view, we have to figure out a better way to make those jobs desirable.
Shannon Ellis is an attorney with the Legal Aid Justice Center. She's spent years working on prisoner health care, specifically at the Fluvanna Correctional Center for Women.
It was built in the 90s with the idea that it was going to be almost a prison hospital.
Fluvanna Correctional Center is one of the 2 prisons chosen as a pilot site for the proposed partnership with UVA.
We're glad to hear that DOC is exploring greater partnerships with UVA. We've actually been urging that for years.
That site in particular has a long legal history with the Legal Aid Justice Center. Just this year, several deaths at Fluvanna raised serious concerns for advocates.
While some certainly were expected from women who were very ill, others have concerning circumstances and were not expected. We're talking about things like desperately needed medications not being available, lack of basic medical equipment like wheelchairs.
For now, individuals from both health systems and the DOC are hoping to improve care, but are still planning what the program will actually look like.
Both the universities, UVA, VCU, and DOC agreed that we needed a little time to figure out what that looks like. So we proposed some interim strategies.
That could include UVA providing treatment for hepatitis C patients in Fluvanna. Carly Kempler, NBC 29 News.